It's really a fantastic meeting. A lot of people come from all over the United States, a lot of people come from all over the world, and we get to sort of hear about what is really going on, what is the latest news, the most interesting research studies that have been done as of late, how is medical practice going to change. It's really a fantastic opportunity to sort of learn about what is really changing in the world of cardiology. One large trial that is ongoing, which is not yet finished, is the Ischaemia trial. That is being led by Dr. Judy Hockman. A number of us here serve on a variety of different committees. We sort of help run the trial. It's really a fundamental trial because it will answer a very important question that a lot of practicing physicians have: how best to treat the patient who has at least moderate ischemia on a stress test. And patients are being randomized to either an invasive approach or a conservative approach, and regardless of what the results will be, it will clearly change practice for decades to come. There will be a study by myself and by Dr. Newman looking at the relationship between air pollution and particulate air matter, how that correlates with the prevalence of blockages in the carotid arteries. And so what we've shown is that in areas in this country where pollution is highest, there is a significantly higher risk of having carotid artery stenosis. Pegasus is a very important trial that is comparing two antiplatelet therapy drugs. It is comparing ticagrelor versus placebo in patients 1 to 3 years following a heart attack. A very important question is, what do you do with antiplatelet therapy a year following a heart attack? And this trial, which was stopped early, the results were partially presented in the media, have suggested that it is a positive trial for ticagrelor, but I think we will be able to look in depth at some of the results of the study. The PROMISE trial is a very important trial. Basically, it is asking, in patients who you suspect to have blockages in their heart arteries and their coronary arteries, is it better to do a functional stress test or an anatomical stress test? Is it better to do a nuclear stress or an echo versus a CCTA? And this is a very important question that many healthcare professionals are asking right now. When your patient comes in, you're worried that they have some type of blockage, what do you send them for? And I think this study will really shed some important light as to how best to treat your patients and diagnose disease. I think that it will probably not be a straight up victory for one or the other. I think it will be a complex, it is a complex question, and I think that complex questions are rarely answered simply. So I think there may be support to use one type of stress test for a single type of patient and another for another type. At the same time, there will also be a cost-effective analysis of this trial. So I think we'll be able to see the clinical results, and at the same time we'll be able to see what is the cost effectiveness of either approach, because in today's era, cost is a very important phenomenon as to how best to treat your patients.